AQA, A-level physics, this is for the medical physics option, and we need to know a bit about ECGs, electrocardiograms. So the beating of the heart is controlled by electrical impulses, and these impulses don't come from the brain, they actually come from part of the heart called the pacemaker, which is why somebody's heart will actually keep beating outside of the body for a while. Now, if we attach metal electrodes in pairs to different parts of a patient's body, we can actually monitor these impulses, and then a doctor can look at the chart and figure out if there's any problems. And the procedure is called an electrocardiogram, or ECG. Now, this is the physics of what you need to know. It is important that there's a good low resistance contact. Sometimes they talk about there being a low impedance contact. It's basically the same thing as far as we're concerned. Between the electrodes and the skin, so that these very, very weak signals can be detected. So the skin is scrubbed, sometimes it's shaved, and a conducting gel contains like an electrolyte. The conducting gel is used, and that reduces the resistance from about a mega ohm to about a kilo ohm. The patient should be relaxed and very comfortable so that any noise, electrical signals from muscles, doesn't interfere with the signal from other muscles in the body. The amplifier should have a very high input resistance. Hopefully you remember that the more current you draw from an EMF, the less terminal PD you get. So basically we don't want to draw very much current at all, because then the voltages we're trying to measure would get smaller. So the amplifier should have a very high input resistance. Now, different pairs of electrodes measure what we call the action potentials of different muscles. If you're doing biology, you'll know loads about this. As the signal travels down the heart from the atria to the ventricles. I'm not going to talk about all the different bits of the heart. You did that in GCSE biology. Now, this is the classic trace, which is an electrocardiograph. And this is for a healthy heartbeat. And this is what the trace you should know looks like. And remember, P, and then QRS, and then T. And P, that pulse, is your atrial contraction, when the atria contract. Okay. QRS is ventricular contraction, when the ventricles contract. Notice that it's bigger because they're much bigger muscles around the ventricles. And then T is ventricular repolarization. When they contract, that's actually called depolarization, and when they recover and get ready for the next one, that's repolarization. So if you like, it's relaxing and getting ready to beat again. So P and QRS and T. Note that it's important that the atria contract before the ventricles, because you're squeezing blood down into the ventricles. So there's a little delay, and that's produced by something called the AV node, and that produces a delay of about 0.2 seconds between the two contractions, or the pairs of contractions really. So bear in mind, it's a physics exam, it's not a biology exam. If there's a kind of a long answer question with 6 marks, hopefully I've given you enough to get plenty of marks on that kind of question.